Hi, Pat Gavin here, and today I'm coming to you from 5 East. It's one of the two units that we've brought up in response to the COVID-19. We don't have patients on 5 East or 4 East at this point, but they are fully ready to be operationalized within a day's notice. So the state, if they choose to activate this center, will also be delivering to us the volunteer corps staff of nurses and aides that would be able to assist in running this side. The hospital will be supplying the other infrastructure, but those two vital resources are really fully utilized inside the rest of our hospital. So with that said, I wanted to just give everyone an update before we get into the Easter weekend and the continuation of Passover with where we're at with COVID-19. As of 10:30 a.m., we have 111 patients in the hospital at Hunterdon. 38 admissions are COVID positive. 22 are awaiting results for COVID, but likely more of them are COVID positive as well. We're seeing 8 patients in our emergency department, of which 1 is COVID positive, and no one is waiting for COVID test results. A little bit more on our COVID tent that is decanting the number of patients in our ED in a few moments. Within the hospital, to date, we have provided over 460 COVID tests and are running about 30% positive rate on the results of those tests. And that's up over where it was previously in the pandemic. In our outpatient setting, which includes the recently reopened respiratory assessment tent, have provided a total of 690 COVID tests. And again, we're running at about that 30% positive there. On the employee side, we've only had 16 employees currently out of 2,800 that have tested positive for coronavirus. And only a few of these employees were in high exposure areas of the hospital. And some even had self-disclosed family members that they had gotten that they thought at home, as well as other community exposures that they may have acquired the disease in. So this is real-time proof of the exceptional job that everyone is doing by following our personal protective equipment policy, for putting on and removing the specially designed equipment to keep us all infection-free, enforcing hand hygiene, and wearing surgical masks in areas of the hospital where that's appropriate. All of those things are things that will help keep us and our whole hospital free of the COVID-19 disease. And I know we've received questions from our extremely generous community with regard to our ability to care for all the patients who may be coming to us over the coming weeks. I just want to assure everyone that Hunterdon Healthcare is extremely prepared to care for those patients during the pandemic. We have in our possession more than 50 mechanical ventilation units and recently received 10 more ventilators from the state of New Jersey and 6 more from the state of California. Our staff continues to do an amazing job managing on our existing supplies, including surgical and N95 masks, and stock is being appropriately replenished. So on that front, we seem to be doing well into the foreseeable future. I'm sure that most of you likely heard about or saw Governor Murphy's recent tweets and his daily update where he actually called out Hunterdon Medical Center for increasing our capacity from 178 beds to a potential of 366 should the need arise, which is a 93% increase. To clarify, 82 of those beds, as I said previously, are located here in the original hospital on the 4th and 5th floors, and patients placed in these beds will be managed by our providers, but all other staff, including nurses and technicians, will be provided by the Jersey Volunteer Corps. These floors were renovated and set up in less than a week, which is an absolutely unbelievable achievement and speaks to the amazing staff that we have. It wouldn't have been possible without the tremendous help of our maintenance department, our environmental services and information services, purchasing teams, and many, many other areas throughout the hospital. Thank you all for being able to put this together on short notice. We could not have done this without you. Typically, this is a holiday weekend filled with religious, community, and family gatherings. But we can't forget the importance of continuing to flatten the curve and prevent the spread of coronavirus. As a reminder, social distancing continues to be a key piece. and a primary strategy to combat this virus. And if we continue to do that, we will be able to bring our families and communities back together when this does end, when it ends. In closing, I want to thank all of our staff for the amazing job that they have done and that they do each and every day here at Hunterdon. Together, we will get through this very trying times, and I wish all of you as peaceful of a holiday and as healthy a holiday as you can possibly have with your families. Thank you again for all that you do.
Hi, I'm Barbara Tofani. I'm part of nursing administration, and I wanted to give you a tour of our new 5 East unit. This unit was part of the old hospital. It was originally a med-surg unit. It had been converted into offices, and we unconverted it and we remodeled it to make it another 48-bed medical surgical unit. So let me just show you one of the rooms that we have set up. This room is fully set up. This is a double room. We have double rooms. We have private rooms in here for patients who are on isolation, who need isolation as well. They're fully equipped with everything that we need to take care of a patient on this unit. Very similar to what we have on the hospital side in the main hospital. You can see if you come up this way, if you look up the hallway, we have carts on here. These are, carts. They're workstations on wheels. So we have all the technology up here as well to care for patients. With our computers, our laptop computers, our barcode scanners, so that when we do medication administration, we're making sure that we're providing the same level of care with the same safety measures as we do in the rest of the hospital. Okay, so we've labeled every bed, A or B, depending on how many beds are in the room. This is room 5808. Every bed has side rails on it. The side rails will drop down so that nursing and the staff is able to get to the patient pretty easily. The patient needs to be elevated in the bed. We have these wedge pillows that are available to us. So if somebody needs to have the head of the bed elevated, we can use the wedge pillow. If they want to sit up in bed rather than in a jerry chair, they can sit up and eat in bed fairly comfortably. From start to finish, it took us about 3.5 days to convert this entire 48-bed unit from a highly functioning office space into a fully functional 48-bed medical surgical nursing unit. Pretty impressive.